Hello, my name is Jessica Walton. I am one of the advanced clinical practitioners who works for Sirona Community Nurses. The purpose of this video is to demonstrate the practical steps that you need to take to verify a death. Now, this is being filmed during the time of our pandemic, therefore I encourage you to, when you watch this video, check the latest version of the verification of death policy, as you will need to check for the latest guidance as things may be changing. As well as that, I would encourage you to check the latest SOP for PPE for what you should be wearing for carrying out a verification of death. For the purpose of this video, I'm just wearing my gloves and non-sterile apron, which is your basic PPE that you should be wearing for any verification of death. So when you are verifying a death, the first thing you need to do is make sure that that patient has been seen by a doctor within the time frame specified in the latest verification of death policy. This obviously is a changeable time at the moment, so I will ask you to refer to that policy. You're going to want to advise the family of what you're going to be doing for the verification of death, so you don't have to give the in and out details, but I suggest you maybe say something along the lines of you're going to be having a look, listen and feel for any signs of life. Family, of course, can be present, but that is up to them whether they choose to be or not. So there are 6 steps to verifying a death. The first step is checking the pupils, and then you're checking to see if there's any reaction to light. So we're going to do that one first. So you're going to be checking each pupil individually, shining a light from the side, slowly across the eye, keeping it on, and then repeating it on the other pupil. Now, when someone has died, the pupils will be dilated. So when you do shine the light, you would expect the pupil to constrict in reaction to the light. So you would expect there to be no reaction in pupils, no pupil constriction. The next step is going to be feeling for the carotid pulse. So the easiest way to find the carotid pulse is feeling for the trachea, your windpipe, and feeling to either side of that, and that's just underneath your jaw or chin. Okay, so I encourage you to have a feel on yourself. It's a very strong pulse. You cannot miss it if you're feeling in the right place, okay? So you're going to be feeling, and you're going to want to feel for 1 whole minute, okay? Once you've checked for a full minute, you're going to move on to the next step, and that is checking for a response to a painful stimuli, which is the trapeze squeeze. So you're going to be squeezing here, in between, on both shoulders. So having a good squeeze, and you're checking for any response in the face or the body. And you obviously would expect no response to that as well. Moving now down to the chest, you're going to be looking for any signs of respiratory effort, so the rise and fall of the chest. Now, I personally would do this at the same time as I'm listening to the breath sounds, and both of those things need to be done over a full minute. So I'm going to take my stethoscope. I'm going to place it on the chest, on the upper chest, and I'm going to be listening for any breath sounds for a minute, as well as observing for the rise and fall in the same minute. If you feel more comfortable to do those 2 things separately, you are, of course, welcome to do that. And then the last step is listening for heart sounds. So again, with your stethoscope, you're going to be placing the bell of your stethoscope on the 3rd intercostal space down, so find your 3rd rib and the space below that, on the left-hand side of the chest. And again, you're listening for a full minute. That is all the practical steps that you need to take to verify death. I encourage you, if you have not listened to breath sounds or heart sounds before, to have a listen on yourself or family or friend members, so that you know what you're listening for. You may hear some sounds if the stethoscope moves, and that is obviously not a heart sound or a breath sound. So just make sure that you know what you're listening for before you carry out a verification of death. The only other helpful tip I would recommend is that you might want to talk to the person who's died as you're carrying out the process. It makes it feel a little bit more comfortable for you, and perhaps for any family who may be present at the time. In terms of the steps you take after you have verified a death, I would now encourage you to look at the most recent policy that you have, because this is being filmed during the pandemic, the guidance has changed, so I encourage you to look at that latest version. If you have any questions following this practical and you're not sure of anything that you may need additional advice for, I would encourage you to speak to any senior members of your team. Thank you for watching.